In the world of antibiotics, each has its unique place and purpose, designed to combat specific infections and diseases. Among these, ceftriaxone stands out for its broad application and effectiveness. This comprehensive exploration will delve into the facets of ceftriaxone, offering insights into its common uses, benefits, potential side effects, dosage recommendations, and associated risks. By understanding these elements, patients and healthcare providers can make informed decisions regarding its use in treatment regimes. Introduction to ceftriaxone. Ceftriaxone, a third-generation cephalosporin antibiotic, has garnered widespread attention in the medical community for its potency and broad-spectrum activity. It is uniquely capable of combating a wide range of bacterial infections, including those that are resistant to other antibiotics. Its formulation allows for it to be administered intravenously or intramuscularly, making it a versatile option for both hospital and outpatient settings. The drug's development was driven by the need for more effective treatments against complicated and resistant bacterial infections, marking a significant advancement in antimicrobial therapy. The pharmacological prowess of ceftriaxone lies in its ability to disrupt the bacterial cell wall synthesis, a critical component for bacterial survival. This mechanism of action ensures the effective elimination of pathogenic bacteria while minimizing harm to the host cells. It's this targeted approach that underlines the drug's efficacy and its esteemed position in the treatment of severe bacterial infections. Embarking on a treatment plan that includes ceftriaxone requires a nuanced understanding of its applications, benefits, and potential risks. This knowledge ensures that the drug is used judiciously, maximizing its therapeutic benefits while mitigating adverse outcomes. The following sections aim to provide a comprehensive overview of ceftriaxone, guiding patients and healthcare practitioners through the critical aspects of its use. Common purposes of ceftriaxone. Ceftriaxone is employed in the treatment of numerous bacterial infections, demonstrating exceptional efficacy in both acute and chronic conditions. Its broad-spectrum activity makes it a first-line treatment option for several infectious diseases. Among its primary uses are the treatment of severe pneumonia, meningitis, and gonorrhea, conditions that require robust antimicrobial action to prevent serious complications. Beyond these, ceftriaxone serves as an indispensable tool in the management of skin and soft tissue infections, urinary tract infections, and intra-abdominal infections. Its ability to penetrate deeply into tissues and fluids makes it particularly effective against infections in these sites. Furthermore, its role in the prophylaxis of surgical site infections underscores its importance in surgical care, reducing the incidence of postoperative complications. The selection of ceftriaxone for a specific condition is guided by its susceptibility profile, ensuring that the causative bacteria are sensitive to the antibiotic. This precision, combined with its broad applicability, cements ceftriaxone's status as a critical component of modern antibiotic therapy, addressing a spectrum of bacterial infections with confidence and efficacy. Advantages of using ceftriaxone. The advantages of incorporating ceftriaxone into treatment regimens are manifold, contributing to its widespread use in clinical practice. Its broad-spectrum activity is perhaps its most significant benefit, offering coverage against a wide variety of bacteria, including many resistant strains. This makes ceftriaxone a versatile tool in the fight against bacterial infections, capable of addressing multiple pathogens with a single antibiotic. Another notable advantage is its pharmacokinetics. Ceftriaxone boasts a long half-life, allowing for once or twice daily dosing. This dosing convenience improves patient compliance, a critical factor in the success of antibiotic therapies. Moreover, its ability to be administered intravenously or intramuscularly provides flexibility in treatment settings, from intensive care units to outpatient clinics. The drug's efficacy in penetrating tissues and crossing the blood-brain barrier adds another layer to its benefits. This characteristic is particularly crucial in the treatment of meningitis, where the antibiotic's ability to reach therapeutic levels in the cerebrospinal fluid is essential for successful outcomes. The combination of these advantages makes ceftriaxone a valuable asset in the management of severe and complicated infections. Potential side effects of ceftriaxone. While ceftriaxone is celebrated for its therapeutic benefits, it is not without its potential side effects. These adverse reactions can range from mild to severe, underscoring the importance of monitoring and management during treatment. Common side effects include gastrointestinal disturbances such as nausea, vomiting, and diarrhea. These symptoms are generally manageable and may resolve with continued treatment or with supportive care. Allergic reactions constitute another concern, with symptoms ranging from rash to more severe manifestations like anaphylaxis. Patients with a history of cephalosporin or penicillin allergies should exercise caution and consult their healthcare provider before starting ceftriaxone. Additionally, prolonged use of the antibiotic can lead to alterations in the normal bacterial flora, potentially resulting in secondary infections such as Clostridioides difficile-associated diarrhea. More rare, yet serious, side effects include hematologic changes, such as thrombocytopenia, and biliary sludging, which can lead to gallbladder issues. These adverse outcomes underscore the necessity of comprehensive patient evaluation and monitoring during ceftriaxone therapy, ensuring that the benefits of treatment outweigh the risks. Recommended dosage of ceftriaxone. Determining the appropriate dosage of ceftriaxone is critical for maximizing its therapeutic effects while minimizing the risk of adverse reactions. The recommended dosage varies depending on the nature and severity of the infection, as well as patient-specific factors such as age, weight, and renal function. For most adult patients with moderate to severe infections, a daily dose ranging from 1 to 2 grams is typically effective. More severe infections, such as meningitis, may require higher doses to achieve therapeutic concentrations in the cerebrospinal fluid. In pediatric patients, dosing is usually based on body weight, with adjustments made to account for the higher metabolic rates and differing pharmacokinetics in children. For neonates and young infants, careful consideration of dosing intervals is necessary due to their developing renal function, which can affect drug clearance. It's imperative that dosing recommendations be followed closely, and adjustments made based on the patient's response to therapy and any side effects experienced. This individualized approach ensures that the patient receives the most effective and safest treatment regimen possible. Risks associated with ceftriaxone usage. While ceftriaxone is a powerful antibiotic, its use is not without risks. These risks can be broadly categorized into immediate reactions, such as allergic responses, and long-term complications, including antimicrobial resistance. The potential for allergic reactions necessitates thorough patient history taking to identify any previous cephalosporin or penicillin allergies, which could indicate a heightened risk of adverse responses to ceftriaxone. The emergence of antimicrobial resistance is a significant concern, with indiscriminate or prolonged use of antibiotics like ceftriaxone contributing to the development of resistant bacterial strains. This phenomenon not only diminishes the efficacy of the antibiotic but also limits treatment options for future infections. Therefore, ceftriaxone should be used judiciously, guided by culture and sensitivity results whenever possible, to preserve its effectiveness and mitigate the risk of resistance. Patients with pre-existing conditions such as renal impairment or liver disease also face increased risks when treated with ceftriaxone. These conditions can affect the drug's metabolism and excretion, potentially leading to toxicity. Close monitoring of renal and hepatic function, along with appropriate dose adjustments, is necessary to avoid complications in these patient populations. Precautions and considerations when using ceftriaxone. When incorporating ceftriaxone into a treatment plan, several precautions and considerations must be taken into account to ensure patient safety and treatment efficacy. First and foremost, a comprehensive patient history should be obtained to identify any potential allergies to cephalosporins or penicillins, which could contraindicate the use of ceftriaxone. Additionally, the possibility of cross-reactivity with other beta-lactam antibiotics necessitates caution and careful monitoring. Patients with underlying conditions that affect renal or hepatic function require special consideration, as these can influence ceftriaxone's pharmacokinetics and potential for toxicity. Dose adjustments and close monitoring of organ function are essential in managing these patients effectively. Moreover, the risk of developing secondary infections, such as Clostridioides difficile-associated diarrhea, mandates vigilance for signs and symptoms of superinfection during and after ceftriaxone therapy. Prompt recognition and management of these complications are crucial for patient well-being. Comparison of ceftriaxone with other antibiotics. Ceftriaxone's place in the antibiotic arsenal is defined by its unique attributes, which distinguish it from other antimicrobials. Its broad-spectrum activity, favorable pharmacokinetics, and ability to penetrate well into various tissues and fluids provide a distinct advantage in treating severe and complex infections. When compared to other antibiotics, ceftriaxone's once or twice daily dosing increases patient compliance, a key factor in the successful eradication of infections. However, it's important to recognize the role of other antibiotics, especially in the context of antimicrobial stewardship. The selection of an antibiotic should be based on the specific pathogen, site of infection, patient factors, and local resistance patterns. This tailored approach ensures the most effective and appropriate use of antimicrobial agents, including ceftriaxone. Ceftriaxone usage in different medical conditions. Ceftriaxone's versatility is showcased in its application across a variety of medical conditions. From respiratory infections like pneumonia to central nervous system infections such as meningitis, its efficacy is well documented. In the realm of sexually transmitted infections, ceftriaxone plays a pivotal role in the treatment of gonorrhea, particularly in the face of rising antibiotic resistance. Its use in surgical prophylaxis further exemplifies its broad utility, reducing the risk of postoperative infections in various surgical procedures. These applications highlight ceftriaxone's integral role in contemporary medical practice, addressing a spectrum of infectious diseases with confidence and reliability. Conclusion and final thoughts. Ceftriaxone stands as a cornerstone of antibiotic therapy, offering a combination of broad-spectrum activity, convenience of administration, and efficacy against resistant pathogens. Its role in treating a wide array of bacterial infections underscores its importance in the medical field. However, the potential side effects, risks, and considerations associated with its use necessitate a careful and informed approach to treatment. Understanding the nuances of ceftriaxone therapy allows healthcare providers to harness its therapeutic potential while mitigating risks, ensuring that patients receive the most effective care. As antibiotic resistance continues to challenge the medical community, the judicious use of powerful antibiotics like ceftriaxone becomes ever more critical. In navigating the complexities of antibiotic therapy, the insights provided here serve as a guide for maximizing the benefits of ceftriaxone while safeguarding patient health. Through informed decision-making and prudent use, ceftriaxone can continue to be a valuable ally in the fight against bacterial infections.